The opioid crisis is destroying communities across this country, but we found a city dealing with a different drug problem. News Channel 5's Matthew Torres traveled to Hopkinsville for a look at their issue.
As law enforcement put their resources in tackling the opioid crisis, the focus for cities like Hopkinsville has been on meth, a problem that hasn't gone away.
There are pictures from several agencies of an issue seemingly tucked away in the shadows of the opioid crisis. Meth was always in the picture, but it's making a comeback thanks to drug cartels. Deaths involving meth in Tennessee increased by about 50% from last year.
Don't want them to become an epidemic. So anytime that we hear about those things, we do pay really close attention to it.
In Hopkinsville, meth has been more of a problem than heroin or opioid abuse. However, it's remained stagnant for several years. To date, there's been around 60 meth cases in the city. Lieutenant Kyle Spurlin says for a smaller city, community engagement and education have been helpful.
That's one of the big things that helps is informing the community exactly what we're doing so that people understand what we're trying to accomplish.
It may also be one reason why Hopkinsville hasn't been plagued with the opioid crisis. Kentucky had nearly 1,600 drug overdoses last year, more than half because of the powerful opioid fentanyl. But in Christian County, there were only 7 overdoses in 2017.
While we may have seen a slight increase in some overdoses, they may not be specific to the opioid crisis.
So far, none of the deaths this year involved opioids, as the department continues to use naloxone to reverse the effects. They even stocked up on dozens of boxes before the eclipse last year, but surprisingly were largely unused until later.
We saved ourselves, some future monies by not having to buy it later.
For now, officials rely on the community as they stay ahead of any drug problems they could face. In Hopkinsville, Matthew Torres, News Channel 5.
Naloxone cost the fire department about $35 for each dose, a higher price compared to several years ago. With some on order, they should be equipped with 50 to 60 boxes.